scanning the room.
Hello, my name is Sarah New and I am a student in the Dakota Nursing Program, and today I'm going to be demonstrating how to transfuse blood. So my patient has received orders from the doctor to transfuse 2 units of packed red blood cells now, and following that we need to obtain an H&H about an hour after the transfusion. So before I do anything, I need to go ahead and go to the patient's room, gather my supplies. So I've got my sodium chloride, 0.9% normal saline. I've got my tubing, I've got the flush. I'm gonna go to the patient's room and just, first of all, verify the need for this treatment. I know that they came in with a GI bleed and their H&H is low. So I know that there's a need for it. So I'm gonna enter the patient's room, identify myself, verify the patient. Hi Samantha, can you please give me your name and date of birth? She does so, and it matches my MAR and my orders. So I need to inform the patient that she is to be getting a blood transfusion and provide education. So Samantha, have you ever received a blood transfusion before? You have not. So I need to let her know when the blood is transfusing to let me know if she feels any kind of fever, chills, flushing, or backache, or if you're feeling any kind of pain whatsoever. So let me know that. She doesn't have any questions. Everything is good. I need to assess the line and make sure that everything is good. No redness, no drainage, no signs of infection, infiltration. Everything looks good. And I'm going to prep my tubing and check that the line is patent. So everything looks good. It is an 18 gauge catheter, so that is the right size for infusing red blood cells. Okay, so we're just gonna go ahead and flush this line. Okay, I will clean that for 10 to 15 seconds. Get the bubble out. Attach, and we're going to pull back for blood return and flush. My line is patent. There's no signs of pain, infiltration. Client states everything is good, so I would flush that all the way in and dispose of that properly. All right, so now we're going to go ahead and prime our tubing. I always want to get this ready before you go to the blood bank because you only have so much time to get the blood into the patient. So that's why we're doing that now. You don't want any of this to hit the floor. Okay, so just make sure everything is closed before you spike your bag. And my normal saline, it has not been opened. It has not been expired. All right, everything's closed. Doesn't matter which one of these spikes you choose, just as long as you keep it aseptic. So I'm gonna go ahead and get our bag, like that. Okay. I'm going to go ahead and open this a little, squeeze in some saline, and prime my tube. This is, it's got the cap on, so I'm just going to let it hang. And get this clamp. That is closed, so I'm going to go ahead and open, keeping that sterile. Okay, so that's good. And just keeping the cap on so everything's clean. All right, so now that everything is primed, we can go ahead and go to the blood bank and get our blood. I just want to hang this so it doesn't get contaminated while we're gone. So, all right, so I would take my gloves off, hand hygiene, go to the blood bank. I'm going to bring my orders with me. So in the blood bank, my medical tech is going to verify everything before I leave with the blood. So I know that I need to verify the name and date of birth first. So Samantha Lewis, 6/10/75. Samantha Lewis, 6/10/75. The patient's blood type is B negative. That matches my unit tag. The donor blood type is B negative. That matches my unit tag. The AFN number matches, is 3889. We've got our PC number, and that is 78500, 78500. The medical tech confirms everything is good. It has not been expired, because it doesn't expire to the 30th. It has been cross-matched, and everything is good to go. So I would take both of these with me to the unit. I did let a nurse know before I left to get the blood that I would need her to verify that is the correct type when I come back to the unit. That way she knows to be on standby. So we're back to the unit. My second nurse is going to help me verify. So we need to look at again, the name and date of birth. Samantha Lewis, 6/10/75. Samantha Lewis, 6/10/75. Blood type B neg, donor and patient match. And of course the numbers match, PCS and the AFN. And nurse, do these match?
Yep.
Okay. And check our bands.
Yep.
Okay, so. All right, Miss Samantha, so we're gonna get this started. Do you have any questions for me before we get this done? Okay, so before we do that, I need you to go ahead and sign your consent form. I've already provided you education and you didn't have any questions, so I'll give you your information. She signs the consent. It's verified that it's consent and signed. So that's good to go. I'm gonna get on a fresh pair of gloves. Again, gonna just check this for the third time. Make sure this stays in the room. And just to get my stuff ready. Okay, so I just wanna get the blood ready before I, again, clean her site and everything. So this is good. This is the correct patient. All right, Samantha, can I please have your name and date of birth? She tells me it is Samantha Lewis, 6/10/75, and that matches my bag. So our safety checks are done. All right, I'm just gonna hold that. Okay, so you just wanna, again, spike your bag. Keeping everything aseptic. Okay, hang your blood. Make sure your label is facing you. Okay, and that is closed. That is closed. This is closed. Okay, so now I need to go ahead and open this. I'm going to squeeze the blood down into the chamber. And that mixes with the saline. And then you would go ahead and prime the blood into the tubing. We have been having problems with our tubing back priming. So we're just gonna see what happens. Okay, so that's good. It's not back priming, everything's dripping. I would want to, after we get this connected to the patient, make sure that it is set to a 10 to 15 drops per minute rate. Okay, so I want to clean this site again. Just again, 10 to 15 seconds. That's clean, let it dry. Okay, so that is in. And now is when we would go ahead and make sure everything is dripping at the 10 to 15 seconds. I would have got a baseline set of vitals before I started. And while that is infusing, I'm gonna go ahead and get another set of vitals. And 15 minutes after that, I'm gonna get another set of vitals. And so that's good to go. Everything's flowing. Make sure the patient is aware to, again, inform me if they feel any kind of fever, chills, flushing, back pain, anything like that. So I would take my gloves off before hand hygiene. All right, so I've come back. It has the blood has been infused into the patient. So now I need to go ahead and get another set of vitals and see how they tolerated it. Go ahead and turn everything off, and you would flush the remainder of the saline into the patient, but since everything is back priming, it's not going to let me do that. And just document everything, the type that was infused, the infusion time, how the patient handled it. And I need to make sure and call the lab to come and get an H&H within 1 hour so that we can make sure that our intervention was successful. So thank you.